To the KUAM News Zoom room where she came for the virtual. My lady turned me on to Poltu and butter, Lillian. So we do have the anchor
All
butter there.
right.
All right, on your way
Okay,
out.
good.
So
I'm gonna enjoy
let's
that
make
virtual protein.
right. Let's make this quick then and get you to that Poltu. Just with our
Yeah.
census, COVID census, Guam Memorial Hospital, Lillian Posadas Hospital Administrator. Good morning.
Uh, Good morning. We have 72 individuals in the house with COVID condition. Of the 72, 15 of them are at the ICU level of care. And of the 15, 10 of them are on the ventilator support, and 10 are at the SIF as of this morning. We didn't have any death over the during the night, so praise God that we don't have that, and
Amen.
hopefully no further
What about staff
loss of
infection?
life.
Staff infection?
What was that?
Have you had any more staff infected with the virus since the last time we spoke?
No, we haven't.
Okay.
We have knock on wood, we haven't had any. Most of the ones that were out on isolation are have been cleared, so I haven't received any notice.
Are there any inmates or detainees hospitalized at GMH that you know of, Lillian?
Not yet. We haven't. We have an on-site clinic there.
Right.
We have staff
Right.
who are monitoring these inmates. I think twice daily, monitoring their oxygen level, their vital signs, and so, hopefully that we can keep them at that point and not needing to be hospitalized.
Right.
Are you going to have to stand up another CARES unit if inmates and detainees are brought over to GMH? Or
We have Care 6 right now. With the staffing situation, we've got a capacity of 10, but we do have additional beds on that floor that, we can open up if we need to. And we're just going to have to, get more staffing, or just the staff are going to work more extra hours. But yeah, we're concerned about that. And even the Black construction workers, we're concerned that they may need to come into the hospital. Yes.
what about any new staff from off island? Any nurses, doctors, respiratory therapists that have flown in the last couple of days?
Not respiratory therapists, but we do have two medical physician intensivists that the DoD HHS sent over to help us out. Although limited time, they're here for just 2 weeks, and so we continue to work with our HHS partners to bring in the medical intensivists that we really need help with, and as far as nurses. I believe there may have been 3 that came in over the weekend. So
Lillian, how are those blue med tents holding up in this rain?
they're holding up because remember they're under that canopy
Oh, yeah.
in the emergency room. So yes, they are holding up. They're protected.
Right on.
Yes.
Great.
Oh, okay. So with the medical
Intensivist.
intensivists.
Intensivists,
Why are they
uh-huh.
only here for 2 weeks?
Because that's these are physicians who work for private companies, private health facilities, and they sign up as volunteers in with the HHS DoD EMAC system. And so they volunteered to come to Guam for 2 weeks, and that's the only time that they can that they can provide to be deployed to help out. So again, it's been really a struggle because with all the cases that have surged in the United States, so all healthcare workers, professionals are being tapped on throughout the U.S.
Wow.
Any other doctors, nurses from this EMAC program coming to Guam?
We don't know yet, but our HHS federal partners continue to search for us to help us out.
Any new information on Regeneron when it's coming to Guam?
We're hearing that the Eli Lilly company and through HHS, Guam is on the list to receive an allocation, a shipment of about 50 doses, 50 vials of that. It's a hard name to pronounce. It's a Bamlanivimab.
Oh, yeah, Bamilani Vanab.
The monoclonal antibodies that we're going to be getting. Yes, from Eli Lilly, pharmaceutical company that manufactures it. So, yes, we're going to be getting a shipment of that antibody that then we can, use as a therapy, outpatient therapy. But we don't know when it's arriving, but we're hearing it's arriving soon. So
At no cost.
it's at no cost because HHS covers the cost.
Oh wow, that's
But
good.
but that's not Regeneron. That's whatever you said it was.
It's Bamlani Vimab.
Hamelani what?
The name of that. Bamlani Vimab.
What was it again?
It's Bamlani Vimab. It's
just wants
B
you
as
to
in
say it.
boy, A-M, L-A, N as in Nancy, I, V as in baboon, I, M as in many, A, B as in boy. Bamlani Vimab.
I think that
The
says a
name
lot
of
about
the
your
medication.
Lonnie
personality.
Vimab.
That your V
Lonnie
is bavoon,
Vimab.
right?
That's
And-
the name of the medication.
The 50 doses, the 50 vials, does that equate to like 50 patients?
Correct.
Okay.
That will receive it. Yes.
So we're getting the Hamelani Vinod, and HHS is going to pay for it.
HHS covered it. Covered the cost. Yes.
Okay. Anything else, Lillian, you want to tell us about that we didn't ask about?
Well, we're still continuing to. I have a meeting at 7:30 with our executive team to, discuss a plan to anticipate the hospitalization of those individuals that have tested positive over the weekend.
Right.
Over the week, and high numbers. So
Right,
we need to
yeah.
prepare for that.
Oh, that's crazy. So 300 some black construction, and you're just looking at the timeline, right? So if they tested positive
Yes.
a few days ago,
Right.
then theoretically they could be becoming very ill through the weekend
Right.
and into next week. Okay.
That's like 400 some
Yeah.
black construction. Right.
Yes. You might need a COVID Care 20 unit.
Right. Can you get us a COVID Care 20?
We'll try our best, Lillian. But thank you for your
All
time,
right.
and make sure you get that virtual
All right.
potu and the butter, okay? Take some for the meeting.
Yes,
Okay.
I will. Thank
That's
you.
that.
All right,
Okay.
take care.
Adjust.
Take care. Take care.